Hi there, this is Dr. Chris Baker, and I thought today we'd talk a little bit about an orthodontic technique that can be a little bit challenging if you don't know much about it. So let me just tell you about how to utilize a bonded RPE, rapid palatal expander, or other large acrylic appliance. Why would you even be using one that's bonded, in other words, acrylic over the posterior teeth? Because the patient is vertical, possibly with an open bite often, and you want to get some posterior intrusion to allow mandibular counterclockwise rotation to improve the overbite, both skeletally and dentally. So if you need a bonded appliance, you can have the laboratory fabricate it with bonding over acrylic over all posterior teeth. Sometimes that is the C's, D's, E's, and 6's. Sometimes it's only the E's and 6's or the DE 6's, depending on what teeth are present. So once you get your design figured out, oh, and by the way, you can add bluegrass beads, bluegrass roller beads to a bonded RPE as well, just like any RPE. Be sure that you have one on each side. You bring your anterior wire extension up and around just behind the central incisors or even the lateral incisors back far enough that they don't impinge on the bite so that the lower incisors aren't hitting them, and then you have bluegrass beads for a habit or a low tongue position. Okay, so now we have an appliance that we've designed. We've taken the impression. Obviously you don't need band fitting. Took the impression of the child. Don't need separators either, by the way, of course. And now the laboratory has fabricated your bonded RPE, let's say. So how do you put that into the mouth in such a way that A, it'll stay put as long as you need it, and B, you can get it off when you're finished? That can be a little bit challenging. So let me give you a little bit of information about technique, because it's actually more simple than you think. First of all, the first thing you do is I use Reliance, the Reliance Orthodontic Company, and they have a wonderful acrylic conditioner. You paint the inside surface of the acrylic appliance, the bonded RPE, with the acrylic conditioner, which is going to help the adhesion of the cement to the acrylic. You paint that, let it sit. By the way, that stuff's stinky, so we try to get it away from the chair side because it really is quite smelly. But it does a great job for you in keeping the appliance bonded into the mouth. The next thing you're going to do, obviously, is prophy and clean the teeth really well. Get them all ready. Floss between the teeth, remove the plaque, just get everything nice and clean. Your appliance is probably designed such that your edges are just capping the buccal and lingual and distal and mesial. In other words, right around the perimeter of all the teeth there. And so what you're going to do is prophy the teeth well, then you're going to etch. Now, carefully listen to this. You're only going to etch the perimeter, the buccal cusp and slightly onto the labial surface, the lingual cusp and slightly onto the lingual surface, and the distal perimeter and the mesial perimeter. So you have etched a round perimeter shape on the teeth. Rinse and dry well. Then, again, I'm using Reliance. We paint a layer of Assure bonding enhancer, and we dry it well with air. You can paint a couple of, if you want to paint a couple of layers, you can, but usually one is sufficient. Now the assistant has filled the appliance with the cement that you're going to use, whether it's Excel from Reliance or whatever you're using. Don't overfill because there's more to clean up, but don't underfill because you want it to cover the areas well on the tooth surfaces that are covered by the appliance. But let me just reiterate, you have not etched the occlusal surfaces. You have only made a dam or a barrier around the edge that's been etched where it's really going to adhere well. Otherwise, you're going to have trouble getting it off later, and it's going to be a big mess to clean up. Okay. Now you fill the appliance, again, not overflowing, but well filled. Make sure it's covering all surfaces. And you place the appliance in the mouth and give it some occlusal pressure to squeeze out, if you will, any excess cement. Be sure that you clean that up with a Q-tip. You can use the cotton end. You can even use the wooden end sometimes to get to areas. You want to get the excess cement out of there. Once you're sure it's clean, then you're ready to light cure right through the appliance, right through the acrylic. That's really all there is to placing the appliance. The main important points here are make a barrier all the way around so that it's not leaking and causing additional risk of decay on the occlusal surfaces. Do not etch the occlusal surfaces so that when you get ready to take it off, it's easier. And then go ahead and do the acrylic conditioner, do the Assure, the bonding enhancement, and do enough cement, but not so much excess that you've got a mess in the mouth. Those are the main points. Now, one last thing. How do you get it off? That's the other trick. First of all, if your laboratory makes you a little round, large omega loop on the labial sides, both right and left, you have something that you can kind of bend out, and it gives you a flexion, if you will, of the appliance, so that you can use your band remover using that hook, using that area to kind of, it flexes the appliance and cracks it off, and the glue comes right off and the appliance comes right off on that side, then the other side. Cleanup is usually pretty easy as long as you've made sure that your glue didn't get all in between in the interproximal. You don't want excess. You want to clean it well with that Q-tip. When you get ready to take it off, there's almost no extra. And boy, I can tell you from experience, when I first did these years ago, I didn't realize how important that cleanup is at the time of cementation. Now we know. And we do a really good job of cleanup, and then we have no problem with removal and no excess cement everywhere, and much less potential for gingival inflammation for the time that they're wearing the appliance, which might be as much as 8 months, sometimes less, but you really want it to work on the vertical growth and intrusion of the posterior teeth. So there are some little techniques for you. Here in the video, we will actually put a photograph of the appliance so that you can see what it looks like if you're interested in seeing that design. And if you have any questions or concerns or needs, be sure and call, email, let us know. I'll be glad to help you with it. So thank you for listening to the techniques for a bonded appliance. Let us know if you need anything. Dr. Chris, signing off.